Welcome to class. I'm hoping that it is recording now. Welcome, welcome, welcome. Happy Monday. Thank you, Mr. Gray, for substituting for us today. You're awesome, and they all love you. Appreciate you taking the time to be with our class. Today, hopefully you guys have already done thankfuls. If you haven't, Mr. Gray can pause, and you guys can give 3 thankfuls and teach him how grateful you guys are to be here. And then we'll keep going. So go ahead and pause if you need to, and then keep going. Okay, now that you're done pausing, let's start off with what we're going to be learning to this section. You guys just finished your thoracic unit where you did the entire spine and you did the thoracic unit and you did all the, we did the cardio unit, we did all the organs in there, and then you did your hips, your legs, your feet, your knees, and your ankles. So this is the next section. Hopefully you guys all know how great you are, and we're going to be using your faces to learn with. So let's start off with head, neck, and face bones. And we're going to move in after that onto muscles. And from muscles, we are going to focus in on micro expressions. It's not a lot of facial muscle tests that you can do to test if something's injured like you do with the joint and where I teach you the special tests. But we do a huge micro expression unit in this section. And you can do micro expressions, and they're used in NASA, not NASA, NSA, and the FBI as human lie detectors, where you use your knowledge of micro expressions and vital signs to tell if someone is lying in a criminal investigation. And I'll delve into that with you when we get back in class. But one of the first things I look at, and you guys don't know, in micro expressions, you can use your face, like I'm mad at you, but you can also use your body language. So when all of you stop right now and look and see if somebody in the classroom is folding their arms, because this is a micro expression, that means that you are closed off to learning. I'm guaranteeing there's somebody in this class that is already doing that. So relax, stop showing me your micro expressions, and hopefully you guys will enjoy what you're learning, because these are really cool things and you guys will be able to use them in life for all kinds of stuff. So it's pretty cool. So let's go ahead and start off with our bone section, and I will get into that as I share my screen. Give me just a second. Always allow, share my screen. And here we go. Now, these are the note sections. I've given Mr. Gray these to hand out so that you'll be filling these out as we do this. It's a pretty quick unit. You guys are going to be focusing after I finish this quick lecture on really learning the bones because you're going to need them. So bones and bony landmarks. So in the skull, you have 28 bones, 14 cranium and 14 facial. So the face is kind of this little area right here. And then the frontal here, parietal, temporal, occipital, sphenoid, and ethmoid are underneath. And then the ossicles are those teeny tiny ones in your ears, the malleus, the incus, and the stapes. For your face, you have nasal bones, lacrimal are right in there. And we call these your lacrimal ducts or your tear ducts because they come out of the lacrimal bone. So these are your lacrimal bones. Maxilla is the top portion, mandible is the bottom, vomer's in here, inferior concha and palatine are in here. And then zygomatic are your beautiful cheekbones. We'll focus a lot on the zygomatic because there's a lot of things there. You have a couple muscles in your zygomatic that give you the Elvis ability to pull up the lips, as well as your frontal bone or your frontal muscle to pull up that one eyebrow when your mom's mad at you or when you're surprised. So here is a side view of a lot of those bones. You can see mandible is here and maxilla is there. Mandy and max come together is the easy way to remember maxilla and your mandible. Remember the word foramen means a hole, and you do have a foramen right here in your mandible. We'll talk about that a little bit later. It's kind of cool. For those of you, the ramus is a section of the mandible. We talked a little bit about that when we were learning how in science, which I know we didn't actually do it in your class, but I taught you guys, you can use the jawbone to decipher whether it is a male or female patient. If we only have bones to look at, your ramus as a male is more square, and this as a female, you can see that it's slightly diagonal. So I can tell you that this is a female casting of a head, which is kind of cool. So we're looking at a lady right here. You got your nasal bones, your lacrimal bones, Don't worry about the nasal spine and aperture. We won't get into that in this class. We do use that as well for telling what culture you're from. That your nasal spine can tell me what ethnicity you are. Then we have our frontal, your ethmoid bones in there behind your eyes. Sphenoid is underneath your eyes, and your parietal and temporal. Here's another view of it. Notice this one actually talks a little bit about sutures. So you have sutures that suture your bones together. Now, when did that happen? You guys remember that when you're babies, you have a little hole. You actually have a foramen, but it fills up. So you hear about those little soft spots in babies' heads, and that is because the brain has not fully formed together. And the reason being, it's pretty hard to have a hole this big and a head this big that, yes, the hole gets a little bit bigger. It gets up to 10 centimeters, but the baby's head is usually at least that or a little bit more. So obviously there's stretching going on during birth, but also the head collapses slightly to allow to go through the birthing canal. And so everybody has that. It's normal. And then as we are finished with our birth, then the head will start to suture. And that's where we get those coronal sutures, frontal sutures, and all the sutures throughout. Squamous suture. And you can see the lambdoid suture. I will not be going into tons on that yet, but we will definitely be learning them in the future. Another view for you. You can see the vomer a lot clearer here. Don't worry about the alveolar margins. We won't be going into that. All right. So our frontal bones, we have vomer, nasal, lacrimal bones, maxilla, mandible, and zygomatic bone. Now, I don't have you guys here to tell me that I'm going too fast, and I know I always go too fast. So if Mr. Gray needs to pause this for you guys to fill stuff out during this, have him pause it. It's okay. I'm not even going to take more than like 15 minutes or 20 minutes on this. So you guys can easily pause if you need time to fill these out. All right? Then we have here a better view of your 14 facial bones. They're considered your facial bones. They're not considered your cranial bones. Palatine, zygomatic, vomer, mandible, maxilla, your inferior nasal concha right in there, lacrimal, and your nasal up top. So here, you guys are going to take time to fill in all the facial bones. You will label them yourselves. And you'll get two different views here because obviously there's some bones that you can't see from this view, and you can definitely see them here. And that is it. See, did it even take 15 minutes? Was it that painful? So take your time, fill that out, and then focus on learning all of these bones. And I will have a paper that you guys will start, and I will have that for him as well. Have a great day. I'll see you tomorrow. Bye.